And a slight increase in COVID-19 infections was recorded in Trinidad a week after the carnival. Epidemiologist Dr. Avery Hines made the disclosure while speaking during the Ministry of Health press conference on Wednesday. He said there was a peak that was higher than the other days in March so far, with an unusual number of cases for one day, March 7th, a week after the official carnival weekend, and a week or two after some official and unofficial carnival events. Hines said Trinidad and Tobago remains in the third wave of COVID-19 pandemic while the country is moving towards endemicity. He warned there is still a need to be cautious as there is always the possibility of another variant on the horizon.
So while we did see that upward peak, that uptick, it wasn't something that caused enough significant severe illness to burden the healthcare system. So it's not that it's concerning that we're missing data. Again, we see it, we know what it's from, but the impact has been mitigated by a few things, and one of them is the severity of the illness itself. The other is that the protocols that would have been in place to reduce risk may also have contributed to blunting or mitigating that impact.
And Dr. Hines, however, noted that there has been a significant reduction in positive cases registered so far this year when compared to 2021.
So that downward trend in numbers by week is being maintained, and we're also seeing a downward trend in that background salmon section, which represents the positivity. And whereas in January we would have seen levels of positivity around 70% of those who were presenting with symptoms and are being swabbed, we're now seeing that we're down to about 32% or so of those who present who are now testing positive for COVID-19 when they are swabbed. So this is again an encouraging trend towards lower numbers and hopefully a more manageable phase of the epidemic.